Well, welcome everyone to our April NETPA meeting. My name is Jose Rojas, and I'm the president of NETPA. And I'd like to welcome you to our employer panel that we have today. Thank you for joining us. All right, before we get started, I just want to do a quick introduction to our board members who are here today. We have myself, the president and treasurer of NETPA. For the last 30 years, I've been in social services, working in the HIV/AIDS field, working with adults covered by Access, helping them find workforce development and employment and rehab services. Currently, I'm a senior project manager and work for the employment rehabilitation team with Mercy Care and the adult system of care. And I have a passion for helping folks find what's meaningful to them and engaging in the community. Next up, we have Leah Hill, who's also joining us today representing Mayo Clinic. Leah has a master's degree in project management and maintains certification in certified workforce development professional, and she has 3 career coaching certifications. After work, she enjoys hiking, biking, and spending time with her family and friends, traveling, cooking, and building her career coaching and HR consulting practice. We also have Winslow Zhang, who's our social media specialist. Winslow moved to the United States back in 2010, attended University of Iowa and received his bachelor's degree in psychology. Back in 2016, he moved to Phoenix and worked as a job developer for Valley Life, helping folks with disabilities finding employment opportunities. Winslow is currently an HR recruiter for Arizona State University. And personally, Winslow enjoys exploring the Phoenix food scene and trying out different restaurants. He also likes to try out recipes he finds online. We also have Maggie Kasperik, who is our secretary. Maggie's an experienced economic development manager with a demonstrated history of working in the health and wellness industry. Her employment history includes AT&T, United States Chamber of Commerce, Simpatico, Mercy Care, and she has skills in sales and business development, management training, and human resources. Maggie has been with us on NETPA for over 10 years. And not to be remiss, we have Sherry Zawinski, who's also a board member. She earned her bachelor's degree in the University of Nebraska in Omaha. She spent the last 13 years in workforce development, bringing businesses and job seekers together, working with TANF and the WIOA contractors and grant programs. In her spare time, Sherry enjoys exploring new restaurants, sightseeing, and spending time with her family and her doggie. All right, a little bit about NETPA and what we stand for. We believe in connecting the underserved to the right employers. We believe in building and growing our community and doing what's unconventional. Together with our community partners, we recognize job seekers with barriers and challenges, and we connect them to long-term gainful employment. Our vision within the next 3 years is to have over 50 organizations belong to NETPA and receive guidance, support, and direction as we help them hire qualified individuals who have barriers and challenges. If you're interested in joining NETPA as an individual, it is a $25 yearly fee. If you want to join as an organization, it's $75, which allows you to have up to 5 employees attend our NETPA meetings, participate in our employer panels, market your job openings, etc. To find out more, there is a link. You can go to netpaaz.com for more information. All right, well, let's get to it. Why are we here today? Today, we are so delighted to welcome these great employers. We have Community Bridges, Elite Community Services, Mayo Clinic, J-Curve, and Terros Health today. So I'm gonna stop sharing and we're gonna get right to it. Welcome all. Thank you for joining us today. All right, so what we're going to do is we're just going to do a panel discussion, and I'm checking in the attendees. For anybody who's attending this session, at any time, if you have any questions, we are monitoring the chat. Please feel free to enter any questions in the chat, and we will gladly ask the employer these questions as we go through our panel discussion this morning. So the first question we want to ask is tell us some general information about your organization and the positions you're trying to fill. And we're just going to start up on my Brady Bunch grid that I have on my screen, and we're going to start with Leah Hill from the Mayo Clinic. Welcome, Leo.
Thank you for having me, Jose. So glad to be with all of you today. Happy Friday. The Mayo Clinic, for those of you who are not familiar with it, is an international healthcare system. We have locations here locally in the Phoenix, Arizona area, as well as Scottsdale, Arizona, Rochester, Minnesota, Jacksonville, Florida, and then international locations in Abu Dhabi, as well as London. So we also have our Mayo Clinic Health System that is in Iowa, Wisconsin, and Minnesota. We are the largest nonprofit organization in the United States with over 70,000 employees. And we have healthcare professionals that are not only clinical, but non-clinical as well. So just because you may not like blood and guts doesn't mean there's not a place for you at Mayo Clinic.
Thank you so much, Leah. Let's hear from you, Heather, regarding Terros Health. Tell us a little bit about your organization.
Good morning, everyone. So Terros Health has been around for over 52 years. We are currently located in Arizona throughout almost the entire state. We have over 14 different locations, and we're expanding as well. So Terros Health is an integrated healthcare company that provides primary healthcare services with an emphasis on helping those that may be struggling with addiction in recovery. We provide wellness services, crisis intervention services, a lot of prevention services for like adolescents, HIV testing, a lot of great community resources. We're hiring for a variety of different positions, most of which would be in direct care, although you don't have to have a background in behavioral health or want to be in direct care specifically, because of course there are administrative positions as well. So a lot of great positions that are available right now.
Thank you so much, Heather. Garrett Miner and Krista, welcome from Community Bridges. Why don't you tell us about your organization?
Thank you so much for having us. I'm very excited to be here. I'll let Krista introduce herself.
Hi, I'm Krista. I am one of the recruiters here at Community Bridges, and we are a nonprofit behavioral health substance abuse treatment organization. We've got facilities and treatments throughout the state of Arizona. A lot of our treatment plans include a combination of education, therapy, housing, medications, peer support. We do provide a lot of other supportive services as well. We have a variety of positions, whether it's administrative, if you're wanting to be more hands-on, if you're interested in nursing, PCT. I mean, we've got so many opportunities for anybody who has a passion for helping others. So we're super excited to be here today. Thank you for having us.
Thank you. Garrett, do you have anything you want to add to that?
No, just echoing that. We're glad to be here with a lot of opportunities to really get a career going. If you're looking for a career move, this is a wonderful organization to be part of.
Thank you so much, Garrett. Bob, welcome from J Curve. Why don't you tell us about your organization? You're muted, Bob.
Sorry, folks. Good morning. It's nice to be back with NETPA. I was a board member for a number of years, from about 2000 to 2014 or something like that. I was very much involved. I tried to figure out how to retire. I can't figure it out. So I decided to come back to work. And I represent J Curve Technologies. We're based, our corporate offices here in Tempe. We've been around for about 16 years. We have about 4,500 employees, so we're not going anywhere. We have locations in multiple states, including Mexico, and we provide customer service for various clients all throughout the country, various different kinds of customer service, from technical support to analysts to straight customer service, and so on and so forth. Right now, because of our expansion and our growth, we've been growing every year for 16 years. I need about 50 customer service people. So I can elaborate further as we progress today.
Now I was muted. Thanks so much, Bob.
My pleasure.
All right, let's hear from Tina Bone from Elite Community Services.
Thank you, Jose. So I am the program director for vocational tutoring and behavioral health services at Elite. We've been around since 2008, and we are contracted vendors of the state of Arizona with vocational rehabilitation and with DDD as well. We also recently have new contracts for behavioral health services support employment, and that's with Mercy Care for ACC, which is the Access Complete Care General Mental Health Population, JMSU. And then we also have the LTC, long-term care with them. And then Northern Arizona, we have currently our REBA provider and also the ACC contract too with Health Choice. I guess it's now Blue Cross Blue Shield. And we are contracted statewide for VR services in all counties. And we have offices throughout the state. We provide services, individuals with disabilities, primary employment services. We have 8 and 9 different contracts with RSA, Woke Rehab. And we also provide services through DED for HCBS services statewide as well.
Awesome, thank you so much, Tina. All right, so one of the things we want to just take a little dive into is talking about the types of positions you have open, and the types of skills, knowledge, and experience needed for those positions. So why don't we go ahead and we'll start with Terros Health. I know you mentioned that the positions were direct service positions. Could you elaborate a little bit about that, and also the kind of skills, experience, and knowledge needed for those positions?
Sure, yes. So yes, I mentioned that most of the positions that we're currently looking to hire for are going to be direct care. So that's like behavioral health technicians, case managers, licensed clinicians. So of course, the requirements for those roles can vary. We also have like nursing positions, medical assistants, other things like that. But to focus on the direct care positions, when I talk about a behavioral health technician, minimum qualifications for those roles are going to be 1.5 years of direct care experience. And we look at that as providing one-on-one care, working with somebody with specific behavioral health concerns, mental health struggles, helping create individual service treatment plans and conduct assessments, working out in the field and in a clinical setting. But at least 1.5 years of some direct care combined with a high school diploma or a GED. Of course, we also welcome associates, bachelor's, master's level education. And then when we hire somebody for those roles, their career level and their pay is based accordingly on their background and their experience and their education. So it really kind of varies, but the minimum is 1.5 years and a high school diploma or GED.
All right, just to add on to that, can you talk about schedules? What does that look like in the direct care positions?
Sure.
Yeah.
So it depends on locations, because we have 14 different locations throughout the valley. Some of our clinics are open Monday through Friday, 7 to 5:30. They're pretty structured daytime schedules. So those locations wouldn't have weekend shifts. But because Terros also provides mobile crisis services, we have some programs that provide wraparound care. Sorry.
That's okay. Yeah, we
Sorry,
can hear
I got
you.
a call. Worst time. So some of our programs, because they provide wraparound care, they have evening shifts, overnight shifts. So it really kind of depends. And that's the nice thing is if you're looking to supplement your income or you want to pick up an evening shift or whatnot, we also have some evening and weekend hours and even overnight shifts as well.
Awesome. Thank you so much, Heather. Let's go over to Community Bridges. Tell us a little bit more about those positions that you have open and the skills, knowledge, and abilities that an individual might need.
Yeah, boy, we have a lot of openings right now. We're eager to really meet with anybody. We've got everything from entry level to senior leadership that's there for you. So as far as what specifically, getting toward the patient-facing positions, you've got things like a peer support specialist that would require 12 months of recovery from either substance use or mental health issues. It's a great opportunity to be somebody who helps support somebody that really is trying to change their lives for the better, and you get to be there to help them walk through that experience. It's pretty exciting to do that. We also have behavioral health technicians that require 6 months of behavioral health experience in some sort of a job that's in healthcare. We can kind of work with you on that. If you don't have that experience, we have recently, as of end of 2021, created what we call a workforce development department that is filled with trainers that are specific to being able to help you obtain peer certification, to become a peer support BHT, so that you can kind of really go and do most all of the positions we offer. And it's a pretty quick training process, so we can get you through that, get you certified, and it's pretty awesome. We have positions that are much like Terros, that are in the outreach community. They're out providing services to persons in the streets that need help. They're helping provide continuing and coordinated care. You have positions like counselors. We do have some facilities that don't require anything above a bachelor's and can still be considered what's called a behavioral health clinician. So if you're looking to get your feet wet, you've just earned a bachelor's in psychology, or let's see, substance use counseling, or even sociology, there are opportunities there. We have lots of openings for nurses. We have LPNs, medical assistants, let's see, admissions and coordinators and discharge planners. Boy, it kind of goes on and on. And then as far as the administrative side, we have opportunities in HR. We have opportunities in finance. We have opportunities in compliance. If knowing the rules is your thing, it's a great place to get a good foot in the door and really start to be able to do good work there. We have, if you're interested in supply chain management, that's a big buzzword that people like to look at colleges. We have opportunities in our procurement department to provide resources all across the 26 facilities we have throughout the state. So a lot of different opportunities. So we're excited to invite anybody to come in and check us out.
Thank you so much. We have a question in the chat for Community Bridges. Someone's asking, where's Community Bridges located in Phoenix? And I know there's several locations, so you may want to elaborate on that.
Yeah, there are. I don't have the addresses memorized, so let me grab them really quick. So our Phoenix is right near the Maricopa County Hospital. So it's off Van Buren. That's called our Central City facility. We provide crisis and inpatient as well as outpatient care there. And then we also have our large one, let me grab that, off of Jackson Street in Phoenix. So two very large programs out there. The Jackson Street location is really geared toward outpatient care. These are individuals that are coming to receive counseling services, maybe ongoing medication services, as well as being part of those outreach programs where you're going out with practitioners and otherwise to provide additional ongoing care.
All right, thank you so much. Krista, I want to offer you an opportunity. Do you need to chime in anything?
No, Garrett pretty much covered it all.
All right, perfect. Thank you so much. So let's go to Bob from J-Curve Technologies. Why don't you let us know about those positions you're seeking, Bob, and the skills, knowledge, and abilities that someone may need to have.
Great, I appreciate that. So my next hiring wave actually starts this coming Wednesday on the 20th. I'm looking for about 50 experienced customer service folks that enjoy resolving issues for people. They're not calling you because they're having a good day. They need something resolved. So I'm looking for folks that have a desire to assist people doing that. Our training is in-house in Tempe at our corporate offices. And training lasts about 3 weeks, and it's Monday through Friday, 8 to 5. And after training, the employees would be assigned a shift, and it's a 365 operation. So anywhere between 6 a.m. and 8 p.m., 7 days a week, and someone would be assigned a shift during that time period, and it would include a weekend day. And after about 3 months, people usually master everything they need to master by the time 3 months comes around, so that they then would have the option to work at home. and or work a hybrid in the office part-time and at home part-time, or just work in the office. So we're completely flexible. I would even consider hiring part-time people. Customer service folks, as all of you might know, are in high demand. So we're one of the folks that are looking for some experienced customer service folks. I don't want to put a number of years or months that you need to be experienced. If you enjoy communicating and you can type at least 30 words a minute because you have to take notes, and you're a communicator, you like to talk, you like to resolve issues, and it doesn't matter what profession you've come from or what you've been doing. If this is the type of person you are, we'll certainly like to talk to you as soon as possible and hopefully offer you a job.
Well, thanks so much, Bob. In the chat, someone's asking, you said you're doing a round of hiring. Someone's asking, how do they apply?
I can give my email address. We have an ad on Indeed as well under J-Curve Customer Service. Either way, it might be.
If you can put your email information in the chat, and just make sure at the top where it says to, make sure you put to everyone, because originally I believe it defaults to your fellow panelists. So you want to make sure the attendees get that information. Thanks so much, Bob. All right, let's go to Tina. Tina, talk to us about the positions you're seeking and the skills, knowledge, and abilities individuals need to have.
Okay, thank you. So right now we're looking primarily for, we call them employment specialists, also called vocational services providers. And we're looking for those individuals. Right now, we're looking for the minimum requirements would be 2 years experience working with people with disabilities. Any populations are fine, preferably behavioral health, but also we have a variety of different disability populations that we serve. So it could be developmental disabilities, individuals who might have hearing loss. We have deaf and hard of hearing department as well here, vision loss, blind, visually impaired, learning disabilities, all kinds of different disabilities. And then the education, of course, the minimum could be a GED or high school diploma. That to be able to have a license, because we do drive to our clients. We don't go in their homes. We actually meet them at public places, in our offices. So you do need to drive, or at least get from point A to point B, to your different clients. There's flexible scheduling too, which is helpful for a lot of people. And this is part-time, hourly pay. And experience to just also be really organized, ability to work independently. We do train one-to-one, and we do train before working with clients, and also when we do work with clients, we'll be working with you one-on-one, and then the client with us in the meeting, so that the person can get paid their actually hourly rate versus their minimum wage rate for training. We also are looking for people who, of course, have to have a fingerprint clearance card, and also be able to pass a background check, central registry, because working with people with vulnerable populations, so that's really important. And good communication skills, of course, and just ability to kind of think outside the box and understand employment services, and just to really have that, I think you can teach people the skills they need, but it's really hard to teach that, compassion and that personality, and to have that, that drive to help others. So I think I covered all the requirements. And again, this is an hourly position and part-time hours to start. And also we're looking for we also have HCBS caregivers that, not my department, another department, but I could also connect you with that person to talk to. So they're also hiring here in the Valley and statewide for HCBS caregivers. Again, fingerprint clearance card. If you don't have one when you apply with us, we can also help you obtain that. Same thing with CPR and first aid requirement for the HCBS caregivers. Of course, the HCBS do require the first aid and CPR, but not for the VR services. That's different for the employment specialists that we're looking for.
All right, thank you so much, Tina.
Thank you.
Just before I get to you, Leah, I just want to circle back around because we mentioned for some populations, a fingerprint clearance card is needed. And I know for a lot of the job seekers that we work with, some may have some barriers or challenges in paying for the fingerprint clearance card or maybe even getting cleared for one. We'll circle back around. That'll be the next question. So just think about how your organization assists people with that challenge, and then we'll answer that after we hear from Leah. All right, Leah, tell us about the positions that the Mayo Clinic is seeking and skills, knowledge, and abilities for those positions.
Thank you, Jose. Did you all know that the Mayo Clinic offers 3,000 unique careers? And that means that there are 3,000 unique job descriptions. And we are actually looking to hire worldwide 4,500 new individuals to fit into those 3,000 job descriptions. Some of the positions that we have posted include part-time, full-time, on-call, remote, on-site, and they're clinical, non-clinical, and entry level through executive level. So there's really something for everyone. Again, I mentioned earlier, clinical and non-clinical professionals, there is a career home for you at Mayo Clinic. We have housekeeping positions available. We have patient transporter positions. Maybe you're just entering the healthcare workforce or looking to see if it's for you. Maybe you're in school now. Maybe you're an entry-level professional. Maybe you're in human resources or marketing or education professional, or even IT. We have those positions available. We also not only have your stereotypical healthcare positions available, such as nurses and doctors, lab professionals, respiratory therapists who've rightly so received a lot of the glory during the COVID-19 pandemic, but we also have executive level physicians as well as research positions posted. So for those of you who may have MDs, PhDs, or even master's degrees specialized in research. So there's really something for everyone, and more information about our jobs can be found at jobs.mayoclinic.org. Thank you.
Thanks so much, Leah. So let's circle back around to the organizations that may require the fingerprint clearance card based on, of course, the populations that you serve, and talk a little bit about how your organization assists individuals in possibly obtaining one, and also if they're having a challenge getting the clearance, do you work with those individuals as well? And we'll start with CBI.
Yeah, so I'll take this one. So we have a lot of different facilities. Some require a fingerprint clearance card, others do not. Obviously, as Garrett mentioned earlier, we kind of have this new workforce development program, and they actually help individuals through the process, and we also do pay for it. If there is an instance where someone cannot get approved, well, we have other opportunities, other facilities that we can work with them. So, you know, it's not whether or not someone can or can't. We always have opportunities for anybody and everybody. And we're willing to help you through the entire thing as well.
Thank you so much. And I just want to circle back before we continue regarding the fingers. This workforce development program, I'm very intrigued about it. Can you just expand on that a little bit for the job seekers that are going to be listening to this that may have a challenge or barrier in terms of going back into the workforce? It seems like you guys are willing to work with those individuals and get them trained up. So can you just expand on that a little bit?
Yeah, absolutely. This is something that's been a desire of our CEO for a while. Just didn't have the bandwidth to get it done. But we brought in somebody who had been with Community Bridges before, had gone out and pursued additional education, came back, and has really built out this entire department. That's the whole purpose is we want to not only bring you in, but we want you to want to stay. Of course, retention, right? The magic buzzword, but bigger than just keeping you so that we don't have to go out and recruit again, is we want you to be successful. We want you to be happy. I'm sure Tina and Heather can speak to this as well, but it is kind of a niche area. It's not something that you go to college and they teach you about it and you go, great, I'm ready to go. Maybe more for your banners and others like that, where there's a lot more mainstream core education on it. But for behavioral health and disabilities health, there's not a book on it as much as there would be for the others. So They created this department so that as you come in and join as a new employee, maybe you have no previous experience, they want to make sure that you have an assigned mentor. They have what they call a peer support educator. So they're there to educate you not only on your role, but more importantly on the company. Maybe you join in this capacity and you think, I don't really know what's ahead of this job. So they help you understand, well, gosh, what are your interests? Let's do some personality tests. Let's give you opportunities to shadow in other job titles. From there, you can figure out what it is you like. Maybe you start in behavioral health as a patient-facing position, like a behavioral health technician, and later you think, you know, I really have an interest in accounting, or I have an interest in compliance, but nobody's given me the shot to do that or the opportunity to do that. I don't even know how to go about it. And so their whole job is to help you become successful so that you're getting a career, not just a job.
Well, thank you so much for expanding on that. I appreciate it. I know, let's go to Terros Health regarding fingerprint clearance card. Can you talk a little bit about the ability to assist individuals, and if someone's having a challenge, does Terros work with them? How does that go?
Well, first, let me say that workforce development program sounds fantastic. I would love to hear more about that too. I'm very intrigued. But Terros Health does require the level 1 fingerprint clearance card for all employees, regardless of whether you're on the administrative side or the direct care side, partially because we are working with vulnerable populations, with children, families, the like. Some of our positions actually also require DCS clearance too, which some of you may know is an additional level of clearance required. So what we do is if we hire somebody, we let them know in advance that they would have to be able to obtain that fingerprint clearance card. If they do not have it, we have the forms. So basically on their first day of employment in our human resources office, we'll take their prints and we'll submit it for them. We pay for it for them. So we're definitely happy to assist with anybody who needs that. If they tell us that they have barriers that may prohibit them from obtaining it, we'll work with them on that. So we can provide them with additional information, kind of provide them with some guidance so that they can, get that clearance that they need. And we keep in touch with them. I actually just spoke with a candidate yesterday that informed me they're working on getting it. So I give them some advice and some tips on how we can try to eliminate those barriers for them.
Thank you so much for that, Heather. Tina, I know you mentioned how Elite assists, but do you want to add any more information to that? I want to give you that opportunity.
Yeah, so just kind of like how I think Heather mentioned, and I think Garrett too, with the fingerprint clearance cards, yeah, because we have working with teenagers and adults with the populations with disabilities, we do have to have that card, and we have some options. So for my side of things, vocational services department, we actually do all of our fingerprinting in our own offices. And if I have my own little kit, and I can go somewhere, and when I go meet them and I hire them, if I have to go to them, I bring it with me and I can do fingerprinting anywhere, and then also if they can't afford it at the beginning of the time, we can also do discuss some options, with them. We can work out with them, like the first 2 paychecks, we can get out of that. We can discuss that option. So really flexible with that. But yeah, it is required for the job, both jobs that we do, the HCBS side of things, also vocational side of things. So yeah, so we can work with them on that. So, we always discuss it. I think individual applicants, we can discuss one-on-one, what they need, and we can try and address that. So we will address that. I'm trying to address that. Okay.
Thank you so much.
Get some caffeine today.
And let's go to Bob. Bob, I'm not, I don't want to assume that individuals don't need a fingerprint clearance card for your positions, but I want to allow you to speak to that as well.
We don't require any fingerprint requirements. However, we do a 7-year background check, criminal background check. We are a casual environment. Dress code is casual. We don't drug test. However, we do have a no drug or alcohol abuse policy. With our background check, we take it case by case. We take a serious look at any regarding any violence or theft. we take a look at that. We don't necessarily rule it out. It depends when it occurred and how, the circumstances and so forth. So it's a case-by-case basis. So we try to give folks an opportunity to come here and get their life back on track or maintain their life on track and stay focused. We offer a supportive environment. I think we have a great HR team. Our team leads are highly trained in communication. So we have a supportive, hardworking, fun environment. Hopefully that answers your question.
Thank you so much, Bob. Yes, it did. Leah, I want to give you an opportunity to speak to this issue.
Thank you so much, Jose. So we do have vulnerable populations within our midst at Mayo Clinic, which would include the elderly as well as pediatric patients. And so as a result, we do conduct background checks on our employees, both clinical and non-clinical. The background checks, like the ones that Bob mentioned at J-Curve, do go back 7 years. And within those background checks, we check for criminal and sex offender offenses, as well as perform education and job history background checks. And if your background check comes back with an issue, it's either that you're cleared or not cleared. It's not that you pass or you fail. We do work with our HR team to have them review the nature of the offense, the length of time ago that the offense occurred, and if any remediation occurred. And the HR business partners team, or we call them employee relations liaisons, will be able to determine if we want to set you up for success. So they'll be able to determine if the area in which you've applied have been accepted into a position would be a good match for that history. And if not, potentially work with you to see if there are other opportunities that would be available for you. So for example, if you robbed a bank, we probably won't put you in our finance department or have you work at a cash register. But again, it's not a one size fits all. We don't want to say no to you up front. We just want to set you up for success.
Awesome. Thank you so much. So we touched a little bit about different unique programs that are meant to retain staff. So my next question is regarding your benefits and your culture. Talk to me about the benefits of working for your organization, and also about the culture, why someone would want to stay and what it's like. I think offering that insight would be really helpful to the folks that are going to see this video. And we'll get started. This time we'll go to Bob first. Bob, why don't you start us off with J-Curve?
Hi, hello again. As I mentioned, we have about 4,500 employees and we've been around 16 years. We have people with us that have been around that long, and we have, an open door policy. We have a hands-on HR staff, hands-on management team, and we try to assist people according to their specific needs. However, the work does need to get done. And we have lots of great benefits, as I'm sure most of you do as well. Life, dental, health, vision, 401k, holiday, vacation, sick time. We offer everything. We also include a signing bonus, and we give incentive bonuses for retention purposes as well, for lots of different reasons. So we try to keep people the best we can, and hopefully if folks leave, it isn't because of something we did, it's because they've moved on for one reason or another.
Thanks so much for that, Bob.
Sure.
And we'll give it to Terros Health. Heather, why don't you tell us a little bit about the culture there and the benefits to coming on with Terros Health?
Yeah, culture is actually one of my favorite reasons that I personally am with Terros Health. I'm a rehire personally, and we do have a lot of people that come back to Terros if they leave for whatever reason. A lot of people want to come back, which I think says a lot about us, because we do have the culture of caring. I mean, inspiring change for life is our tagline. We offer a lot of great benefits like the medical, vision, dental, retirement savings, paid time off. We have a terrific wellness program. So our core benefits are fantastic as well. But on top of that, one thing that I love about Terros is there's so many opportunities for growth. We do promote within quite frequently. We definitely want to encourage individuals that want to grow their career with us. So if you're going on for higher education, you complete your master's and you want to become like a licensed clinician, for example, there's always somebody who's happy to help get those supervision hours you may need or help you reach those next milestones for your career growth. So I'd say that is really something that's really wonderful about Terros is the long-term opportunities, and then training as well. First day training, shadowing with your team. They basically walk you through whether or not you've had any experience in the field. It's brand new for you, training from the get-go. And then, there's always continued training throughout your entire career as well. So a lot of different things, but I think it's mainly just we work really well together, and there's a lot of folks that have been here for several years. And I'd say it's because of the people. The people are what really makes Terros special.
Thank you so much for that, Heather. Tina, tell us about Elite and the culture there and why someone should consider coming on.
So like Heather, I'm a little bit like Heather with our agency, we have that, our culture is really that, we are, I say kind of like a family. We're statewide, but yet we are very close, and we offer we don't offer the benefits for medical benefits per se, but we offer, the one-to-one training. Like when you get on board at Elite, the right away you will get within the first 2 days of hire, you will have training one-to-one with our COO, who actually does all of our new hire training about, review of our services, overview of our services, about our documentation when we do billing, monthly billing, and then the coordinator who has hired the individual will then meet with that person. And sometimes I help with those as well as a director, and I'm also covering the West Valley, so I'm doing coordinating as well right now. Meet with them to do some a little bit more overview. Then we kind of individualize our training so that it meets that person's needs, learning style. Everybody has challenges. Everybody has different kinds of way of learning. So we're really big about that. We're all about the individual, our employees. And like Heather mentioned too with them, and a lot of you guys do too, we promote from within. Right now, all of our coordinators start out as a provider at one time. So they're all, we have a coordinator in Ashley Huff over in Prescott Valley. She was a provider for us, left, went to work for DES, came back to us, and now she's our coordinator. She's amazing. Susan Beckerman on the phone with us today, listening in. She actually is our East Valley coordinator. She was a tutor and a provider in Tucson, and then I needed to hire someone in the East Valley. She moved up here, perfect timing. She's been our coordinator for quite some time, I think 4 or 5 years. And then, our providers some of our providers have also kind of Valley moved to positions where they were providers. Now they were coordinators, or some people of our HCBS people are working at our corporate office over in Gilbert right now. Some of our people have moved from an admin position to an HCBS, position. So it's been really big about that at Elite. We like that. Flexible scheduling is important too. I think that's right now and nowadays, we have flexible scheduling. And I have providers who've been with me for 4 years. I hired them myself about 4 years ago. I had one just retired after being here 5 years, just retired with us, a peer support. She's peer support, and she's one of our providers for vocational services. She's awesome. So we have a lot of that, that family, that connection, that support. We help each other. We teach each other. I can work with a provider from another area of the state. I can go up there in person. I can do the meets. We kind of work together. We also, the mentoring component is there too. And we're not going to put a provider out alone with the client unless they're actually comfortable and they're ready to go. We'll join that, the coordinators, or I might join that provider and work with them, with our clients and members, working with them in one-on-one. So we also offer that. And I think it's just and shadowing and the tools that they need. If they don't have what they need, we'll ask them, what do you need? What kind of tools do you need that you don't have right now? What can help you, be more comfortable and get the work done. So we're really communication. I think communication is very important with our employees, and we communicate, email, text message, telephone. So I think that's also part of that, our culture.
Thanks so much, Tina.
Thank you.
All right, we'll give it to Garrett and Krista to talk about the CBI culture and why someone should come on board with you guys.
Absolutely. So first and foremost, as a culture, it's very team oriented. Reason being is one, that's always a nice place to work when you feel like you can work within a great team. Two is our patients really need great care. And in order to provide the best service for them on an individual basis, we really need to be coordinated in our efforts. So in order to do that, we really have to get along. We've got to work well together. So it's very team oriented, really working toward making sure that you're comfortable in the team you're with, and that you're giving or receiving, I should say, the support that you need from your leadership team, from your coworkers. They really don't want to leave you kind of feeling like you've been put on an island or, dropped off and said, good luck. We want you to be successful. So really a team-oriented culture. Another part of that great culture is we want them to have a work-life balance. We recognize that first and foremost, the healthcare industry is always a strong industry to be in, to have a career in. It's something that's never going away. It's constantly in need. And so it's an exciting place to be, but it also can be a bit draining. Your whole job and focus is to try to care for and meet the needs of others, which can leave you feeling a little burned out. And so we want to make sure that you have a strong work-life balance. We do that by within the first year with your first year of employment, you have approximately 5.2 weeks of PTO, and it grows from there with every year of employment. And so we want to make sure you have time off. The other thing is we have the 312s, as they say. So 3 12-hour shifts, work 24/7. So you can pick shifts that work best for your schedule, nights, weekends, days, whatever the case may be. And we, again, being flexible and wanting to support you, we take you as you are. We want to bring you in and help you and grow you and help you achieve what you want to do. We accept high school diplomas for nearly, I'd say about 60 to 70% of our jobs. And then we want to help you move into advanced education if that's your goal. We offer tuition reimbursement because we need counselors, we need nurses. So if you have any sort of desire to do that, we will get you involved. We have partnerships with a lot of the universities here in the state, and we can help you do that. Back to that workforce development plan, they'll mentor you through that. And then we also have, for certain positions, we have student loan repayment plans where the agency will help you repay your loans for positions like nurses. So really trying to give you that whole supportive, team-oriented culture.
Thanks so much for that, Garrett. Krista, do you need to chime in?
Yeah, I just have one little thing I want to add. Garrett did a great job, but I want to point out that we also have a lot of really great career growth opportunities. Just as an example, CBI doesn't necessarily just advocate for our patients and the people who come in for help, but that actually continues beyond that. We give them jobs. And we really, advocate for well-being and career growth. We have a lot of people who started out as peers and now hold leadership roles. And I think that, that's something to be proud of and also something that, I stand behind.
Thanks so much. Last but definitely not least, we'll go to Leah so she can tell us about the Mayo Clinic culture.
Sure. Thank you, Jose. So a few things I want to mention about the Mayo Clinic culture. It is amazing. Lots of opportunities for career growth. Like I said, those 3,000 unique job descriptions. But also, I myself have been with the Mayo Clinic for just under 3 months, and I received my first promotion. So I'm going to be starting my second career with Mayo Clinic in just a short amount of time. And so many opportunities for growth and development. Education. When you look at the Mayo Clinic logo behind me, there are 3 shields, we call them. And one of those shields is education. We are strong believers in education in terms of educating our direct care as well as non-direct care professionals and giving them opportunities for continuous education. And we have both a condition of employment program where we may ask you to, as a condition of employment, pursue higher education, where we will pay 100% direct pay to the academic partner, not reimbursement. So you can pursue higher education, as well as a career investment program where we will pay for you to go to school. Again, direct pay to the academic partner, so you can better yourself and look at ways that you can upskill and move into additional roles at Mayo Clinic. Another thing I'd like to mention briefly at Mayo Clinic is its culture of diversity. That's one of the reasons that I was interested in joining the Mayo Clinic family is because in this day and age of international unrest, as well as the civil rights movements, both nationally and internationally, Mayo Clinic has been a leader in providing diversity options for education, continuous growth and opportunities to learn from one another during these times for over 10 years to their employees through our employee resource groups. And we're really looking for individuals that embody our values, not only in terms of accepting diversity and potentially being open to further education, but those values are respect, integrity, compassion, healing, teamwork, innovation, excellence, and stewardship. Those values are infused in everything we do and throughout our culture in terms of our performance appraisals, our job descriptions, and everything else. So thank you for the opportunity to share.
Thanks so much. So we are hitting the hour mark now. So as we move towards wrapping things up, I want to talk about the application and interview process. Many of our job seekers have come back to us and said, oh, the employer never responded. I never got a call back. So why don't you walk us through the process from someone applying to the time it takes to get an interview, how long that process takes, what that process involves, and we'll get started with you, Bob.
Great. I think we have a simple process. If someone sends me their resume, I'll call them, I'll do an interview, maybe sometimes a video Teams interview, and in many cases, I'll hire that person on the spot. Pending successful completion of our assessment process, we send a link with a basic typing test, a basic computer skills test, things like that. And virtually the candidate is in control over when they actually get formal hire based on when they communicate those assessments to us when we get the results. I'll bring someone on board even before we get the background check complete. So we're very open, we're very flexible, we want to hire people. So it's a simple process. You send me your resume, I'll give you a call. You'll never say, no one ever called me. Me or one of my team will call you right away, and we will interview you while we're talking to you. So you're in control, the candidate is control over that, whether they have time to interview at that point or not. And if they do, chances are we might offer you a job right there on the spot and send you the assessment. You complete the assessment, you come on board at our next wave that starts on the 20th. Simple process.
All right, thank you so much for that, Bob. And let's go over to Community Bridges. Talk about your process, please.
Yeah, so we have a pretty large team in our HR and recruiting department that is really geared, especially right now, toward bringing people on as quickly as possible. We want to make it a seamless process for you. We communicate in the threes. We tell you what we're going to do, we tell you why we're doing it, and we tell you when it's done. So you'll hear back from us quite frequently. And so as far as application to when you're starting, if you apply on a Monday, we will respond to you at no later than Tuesday morning. Again, we're being pretty aggressive. We want to get to talk to you. When we reach out to you, we're not reaching out really to screen you. We're reaching out to schedule an interview. By the mere fact that you've applied and you meet a certain qualification, we're ready to interview you. So we'll interview you within a day or two. We'll start the background process and have you up and running within anywhere between 10 days to 2 weeks, meaning that you're starting your first day of training and getting ready to start the following week, or if you're a nurse or a counselor, 2 weeks after, you'll go through 2-week training process and be on site. So it's pretty quick.
Thanks so much for that. Krista, anything to add to that?
No, thank you.
All right. So Leah from the Mayo Clinic had to drop from the call because of a scheduled meeting at 11. So she typed her answer for me in the chat. So I'll read her answer to folks. So at Mayo Clinic, they do require a cover letter and a resume to apply. Make sure to apply for any and all positions of interest, no maximum limit. So if you see 10 positions you're interested in, you can apply for all 10. After the application is submitted, an interview may be scheduled with the hiring team. After the employment offer is extended and accepted, the candidate is scheduled for a pre-onboarding health assessment, drug screen, and background check. Now, once the health assessment, drug screen, and background check are cleared, the employee starts. And Leah also left in the chat to everyone. There is a career opportunities webinar on May 10th at 3 p.m. And there's a link if you want to register to find out more about the Mayo Clinic career opportunities. So thanks so much for that, Leah. And so let's go over to Tina. Tina, why don't you fill us in on the process to apply and what that process is like?
Okay, thank you. So yeah, with us, pretty quickly, so being the director, and then, you know, we have coordinators that do their actual own hiring and their own interviewing. And if sometimes I might sit in, sometimes I don't, just they do their own. And I do the interviewing and hiring right now for West Valley and here in Maricopa County. We would just, they would send an email, resume over to me, and I can share information in the chat section too, or call me, but send me a resume. I apply to them within 24 business hours. If it's in another location, like where Susan Beckerman is hiring and supervising, I'll send it over to her right away. She'll reach out within 24 business hours as well and talk to the applicant, schedule them an interview, whether it be in person, Google Meets. It's just nice to have that, you know, that face-to-face, not just the telephone. It's nice to have both. And then also once we interview, well, you know, we have interview whether or not we're going to hire them or not, and we get them. The process is kind of different with vocational rehabilitation. I don't know, some of you probably know that they have a third-party contracted management vendor, so it's a little bit of a delay. So we can approve them on our end, like within a week or two, because we do central registry background, but sometimes we have to wait sometimes a bit longer for that other entity to approve them. But meanwhile, we're doing training for them. We're getting them ready for those services that are not underneath that other company that does, you know, the background for their own background check. So we get them started with career exploration services to clients, support education. If they can do tutoring, we'll do something. They can do tutoring for us, and we get the training started right away when they're approved by our HR department. I think to answer everything? I think so. So that's kind of our process.
Yes, you're good. Thank you so much,
Thanks.
Tina. Last but definitely not least, let's hear from Heather regarding Terros Health's process. Thank you so much.
Yeah, thank you. So we do require applicants to submit an application and a resume, which then is reviewed by our recruiting team. We have a medical recruiter, and then we have 4 recruiters on the human resources side. All have different areas of focus and different programs that we specifically support. Different programs have slightly varied methods for recruitment. Sometimes the hiring managers themselves, who have access to our applicant tracking system, can review resumes. They can contact applicants themselves directly as early as same day that they apply. The recruiters are also reviewing resumes and contacting applicants as soon as possible. We reach out to them and have a brief phone conversation, and then we coordinate for them to interview with the team. Some managers are interviewing by phone, some by video, some in person. They all kind of have their own personal preference. And then we, of course, ask the candidate if they have a preference as well. But the nice thing is generally managers will make a decision after that one interview. So we do move pretty quickly. When they find an applicant they want to proceed with, they reach out to us recruiters right away. We then extend an offer. We do require a 7-year background check, negative drug screen, TB test results, some documentation. Our typical onboarding timeframe is about 2 weeks, which is pretty standard and usually plenty of time for folks. And then we do have new employee orientation classes every other Monday, so every 2 weeks as well. So overall, the process is pretty quick. Of course, if you have somebody who has a barrier like fingerprint background or DCS clearance, sometimes that can slightly affect start date options. We also do have to require the COVID vaccination for employees. If they don't have it and they submit a medical exemption request, that can sometimes delay start dates as well. But 2 weeks is pretty standard for onboarding, but because we have a lot of positions open, a lot of recruiters, we're trying to move pretty quickly.
Oh, well, thank you so much for that, Heather. And I think you brought up a good point in regards to COVID vaccination, because that's something that we didn't touch on. Let's hear from all the employers regarding COVID vaccination, because I know for direct service work, it's something, in the health field that's been required, but I want to hear from the other organizations regarding that. So let's go with Tina and then first.
So right now at Elite Community Services, for the vocational services and for HCBS, we do not require employees to be vaccinated at this time. And so, yeah, it's not a requirement for us at this time. So.
Okay, thanks so much. CBI.
So we do require either a vaccination record or a request for exemption.
Thank you for that.
Yeah.
Bob.
We don't require vaccinations. We do require masks, however, if someone is away from their desk. If they're sitting at their desk, they don't have to wear a mask. But if you're in our facility away from your desk, you're required to wear a mask at all times. But we don't require any proof of vaccinations or anything.
Thank you so much for that. So as we start to wrap up, I'm going to ask these great organizations to put their contact information in the chat. So if anyone wants to reach out and inquire about any of the positions that you have opening, or just to get some more information that we weren't able to cover today. So if you could do that, that would be great. And then I'm going to do one last go around for any last statements or comments you want to make before we wrap this up. So Tina, thank you. Since you were the first one to type, you'll be the first one for the last statement. Go ahead, Tina.
I was busy typing that big long thing, right? Like I missed the question. What'd you say? I'm so sorry.
Do you have any last statement or comment you'd like to make to the job seekers that are going to see this video before we wrap up?
Thank you. So for Elite, I just think, it's really just, we want to make sure that, like, I love that Garrett said earlier, he said that this is about a career, not a job. I love that. And we also work with individuals finding jobs, at Elite. So same thing, we kind of make sure that they understand that we're helping them find their career, not just a job, right? And with Elite at us too, we're, like I mentioned earlier, our culture is like that, we all are a team, we're kind of like a family, and we all work together to help each other, whether it be program director, helping a provider, a coordinator, helping, a director, or a provider helping a director, we all work together. So it doesn't matter, what our actual titles are, right? But we want to make sure that we come to us to make sure that we help you to learn the best way you can learn, what works best for you. That's really important, and that we can meet their needs, and just kind of getting them trained and getting them moving forward to work with our clients and members. So,
well, thank you so much for that, Tina. Bob, any last statement you'd like to make to the job seekers?
Yeah, folks, we're ready to field phone calls and resumes right away. So send them over and you'll be contacted right after we receive it.
Thanks so much for that, Bob. Now I'll give it to Heather from Terros Health.
Yeah, I didn't mention earlier, but we are also hiring for peer support specialists. So those only require a minimum of a high school or GED and about 6 weeks of work experience. And we also have a peer development specialist that can help somebody who may qualify for that peer certification, but not necessarily have that. So that's another position I want to point out, that we're definitely willing to help folks that qualify to get that requirement. It's a valuable position here at Terros. But yeah, we have a lot of different positions available, career growth options, long-term growth. I put my contact information in the chat box. So if anybody's interested, just let me know.
Thanks so much, Heather. And last but certainly not least, CBI, would you like to close this out?
Yeah, I just wanted to thank you for, again, allowing us to be here. We have a really, broad range of job opportunities for anyone, and I would love to hear from you guys. I put my contact info in the chat. There's my phone number, my email, as well as the company website. Please reach out. You can call me, email me, and I can also walk you through or answer any other questions that you might have about, our processes or, just the positions that we have here.
Thank you so much for attending today and letting our job seekers know about these wonderful opportunities that are available to them. So again, thank you for that. And before we wrap up, I just have a couple of things to share. So let's get back onto this. All right. So again, let's thank CBI, Elite Community Services, J-Curve Technologies, Mayo Clinic, and Terros Health for helping us out today and letting us know about these great opportunities for our job seekers. So the next thing I just want to talk about is just a couple of free resources that are available for job seekers and employers. We have Arizona at Work, which is www.arizonaatwork.com, where you can find out what's available if you're a job seeker, and also as an employer, how they can assist in marketing your open positions, as well as Arizona Job Connection, which is www.arizonajobconnection.gov. If you're interested and you're a job seeker and you want to get job blasts sent directly to your phone, all you have to do is text AZ at work to 22828, and you're going to get a text message back asking you to input your information, and you'll start to get job leads directly to your phone every Thursday. So what's coming up for NETPA? In May, we are super delighted to welcome Kevin McCloskey, Senior Director in Partnership Development with Disability Solutions at Ability Beyond. He's going to be speaking to employers and our community partners regarding mental health in the workplace. So don't miss this opportunity to attend this presentation on May 20th. You can register at www.neptaaz.com. And for all of you celebrating the weekend, happy Passover, happy Easter, have a great weekend, and we'll talk to you soon. Thank you all so much.